Hi there, this is Mathew Sosebee,
And April Larson.
and we're here to present the intervention model known as JASPER. So big picture, what is it? The goal of JASPER is to teach the foundational building blocks of communication and language skills. This is achieved through joint attention, symbolic play, engagement, and regulation. Together, this creates the acronym JASPER. So the overall goal, this approach is based on the idea that children learn best when they have opportunities to interact with more skilled communicators. The goal of JASPER is to support children's social communication skills through play routines. These play routines provide opportunities to advance children's play skills both in flexibility and level of play. The sessions include semantic instructions that engage the child in the development of play routines for the purpose of teaching the child to communicate. Another goal of JASPER is to decrease time when children are solely object engaged and to increase the time the child coordinates with social communicators or communication between objects and the social partner. Play routines within JASPER provide opportunities to advance children's play skills both in flexibility and level of play. A great part about JASPER is that it can be added to other intervention services the child receives.
So who is JASPER for? Because JASPER is based so heavily in play, it is best suited for children, specifically for children learning language up to 9 years old who are minimally verbal. The strategies may also be useful for individuals 10 and over who are minimally verbal if the materials and activities are appropriate. However, it has not been tested on individuals over 9 years old. JASPER is appropriate for and has been tested on children with autism, Down syndrome, and tuberous sclerosis complex. The approach isn't just used by SLPs, but it is also utilized by other therapists and individuals, including occupational therapists, paraprofessionals, teachers, and even parents. In order to implement the JASPER intervention, you won't need much you probably don't already have. The only materials required to implement JASPER are a small space on the floor, a table and chairs that fits the child, containers to keep the toys organized, such as bags, bins, or shelves within reach, toys at the child's developmental level, an AAC device if the child uses augmentative and alternative communication, and time. There are 2 demands of time when it comes to JASPER. The first is time spent in therapy with children. JASPER can occur anywhere, such as at home, at school, or in a clinic. As a therapist implementing it, you will engage in 30 to 60-minute sessions 2 to 4 times per week. It can take around 15 minutes to prepare for each session. The second time factor is the time spent being trained in implementing the strategy. While anyone can be trained, you should have sufficient child experience and the motivation to implement the intervention as designed. The training to become a one-on-one JASPER therapist involves direct instruction followed by remote feedback and supervision. The initial 5 days of training consists of daily lectures and 3 to 4 sessions per day of guided practice. This direct training is followed by the trainee submitting videos weekly for feedback and review until he or she reaches fidelity. JASPER is a dynamic intervention that is flexible and adaptable and can change depending on the individual needs and progress of that child. You can adjust the techniques as you see fit, and there are no linear guidelines for sessions. One session might address dysregulation, while another can target increased engagement, but all the strategies are used consistently and in conjunction with each other to improve that child's social communication. It's essential that you keep the flexible structure, as each child has unique goals that can and should change over the course of the intervention and even within a single session. The overarching goal of all sessions is to create a motivating context for the child to learn and engage with you, the clinician, or with the parent. The context is child-led and seeks to create as many opportunities as possible to teach new skills within a play routine.
So support and structure. Support and structure within JASPER comes in the forms of various intervention strategies. First is the environmental arrangement. The environment should be relatively distraction-free and have age-appropriate materials for the child to engage with. The clinician will imitate appropriate play acts. For example, if a child stacks a block, the clinician stacks the block. The clinician establishes a base routine, meaning the child follows 2 or more step directions during play. For example, a child building a tower and putting a person on top. This facilitates comfort with the intervention or with the intention of building momentum within the play routine. Once the clinician establishes a base routine, you can extend that routine to include new toys or types of higher level play. This also helps keep the child interested. So, continuing support and structure, following this is it is prudent the clinician imitates, models, and expands communication throughout the play. For example, if the clinician places a baby into a bed, if the clinician places a baby into a bed, he or she can comment, "Baby sleeping." The clinician waits for the child to communicate, not speaking on the client's turn. If the child responds, the clinician can expand by adding 1 or 2 new words. Because children with ASD benefit from clear and semantic opportunities to learn new ways to communicate, modeling gestures during play routines is an essential part of JASPER and is referenced to as programming. Programming involves setting up clear opportunities for the child to communicate within play routines. Lastly, the clinician should utilize strategies to maintain engagement and regulation throughout the session. In order to support engagement, the clinician can modulate affect, meaning being excited or calm to match the child's needs, or taking turns quickly to keep the child motivated. If the child becomes dysregulated, the clinician can identify the function of the behavior and respond appropriately based on the identified function. For example, one can ignore the behavior, redirect attention, provide visual support, or place a clear demand that the child can follow through on.
That's how you do JASPER, but let's talk about the principles and the theoretical bases. JASPER was derived from both developmental and theoretical perspectives. Lev Vygotsky plays a fundamental role in the theoretical basis behind JASPER. He stated that children learn from repeated social interactions with a more sophisticated partner, a key basis of the JASPER model. He emphasized the role of social interaction in children's speech and reasoning development, and that community plays a central role in making meaning. Vygotsky emphasized the importance of language, interpersonal communication, and relationships in the learning process. For example, in illustrating the importance of language development of children, he noted, "Just as a mold gives shape to a substance, words can shape an activity into a structure. The structure can be changed or reshaped when children learn to use language in ways that allows them to go beyond previous experiences when planning future actions." He also stated that every function in the child's development appears twice, first on the social level and later on the individual level. The model also draws from social interactionist theory, of development, social pragmatic theory, behavioral theory, and the following slides will dive into more detail about each of these theories. The social interactionist theory of development. The JASPER approach also pulls from this theory, also known as social interactionism. The key concept of this theory is the zone of proximal development, which represents the difference between what a child can currently do independently and what the child can only do with guidance and support. A more sophisticated partner can scaffold the child's learning and development within the zone of proximal development. The child's ZPD will keep changing as the child masters new skills. JASPER also draws from the social pragmatic theory. More specific to language development, Tomasello's social pragmatic theory recognizes language development as an inherently social process. Children's language development is supported through periods of joint engagement, which provides a referential context for children during social interactions to determine their partner's communicative intentions and to learn meaningful language.
All right. So JASPER also draws from the behavioral theory. So behavioral theory is a psychological approach that explains human behavior by observing individuals' actions and reactions to external stimuli. This theory suggests that an individual's behavior is shaped and influenced by their environment, and that behaviors can be modified through reinforcement and modeling. It provides insight into how individuals respond to different stimuli and how environmental factors can modify their behavior. Behavioral theory is closely tied to observational learning, in that people can acquire new behaviors and responses by observing and imitating others. In our case, observing the adult or clinician in session. It emphasizes the role of modeling and vicarious reinforcement in shaping behavior. In JASPER, therapists and caregivers provide immediate feedback and reinforcement when children engage in desired social interactions, which helps shape their behavior over time. This directly correlates to behavioral theory.
So to summarize the theoretical bases of JASPER, this method uses elements of a number of theories. It pulls together Vygotsky's repeated social interactions in the social interactionist zone of proximal development using the social pragmatic element of joint engagement. Finally, it requires explicitly taught behaviors using behavioral theory. JASPER is included in the broader category of naturalistic developmental behavioral interventions, also known as NDBIs. And according to Schreibman et al., NDBIs represent the integration of ABA and developmental science, and they not only allow us to achieve more substantial and accelerated child learning and behavior change, but they are particularly well suited to the infant and toddler autism population now being served. The underlying assumptions of the JASPER approach are that there are core deficits in young children with autism spectrum disorder and assumptions about the modifiability of these deficits. First, it assumes that there are pre-language deficits such as initiating and responding to joint attention, as well as a deficit in diversity in the use of functional and symbolic play. Secondly, it assumes that the social communication difficulties demonstrated by children with ASD are related to their development of language. Thus, a reasonable assumption that we teach joint attention skills may lead to better language outcomes. Finally, teaching children with ASD to develop spontaneous initiations of joint attention or to use imagination in their play requires the integration of teaching approaches from both developmental and behavioral theories of learning. Developmental approaches address the developmental delays, and behavioral strategies address interfering behaviors such as rigidity and resistance to change that can limit learning.
So the empirical basis. JASPER is evidence-based and has been rigorously tested through randomized control trials. As we all know, this is the gold standard for determining efficacy. These trials demonstrate gains in children's time jointly engaged in play activities with others, initiation of joint attention, language, play diversity, and play level. Short-term longitudinal follow-up studies found that children maintain these skills, and long-term follow-up studies find that follow-ups find maintenance of social communication skills and gains in language and cognitive skills.
In conclusion, the JASPER intervention is an approach that helps children improve their social communication and language skills. It focuses on creating motivating play routines and providing clear opportunities for children to learn and engage with their social partners. The intervention is flexible, allowing therapists, caregivers, and parents to adjust strategies as needed. It is essential to maintain a child-led, supportive, and structured environment to maximize the benefits of the JASPER model. It is based on sound evidence and is designed for children with autism spectrum disorders, Down syndrome, and tuberous sclerosis complex. It is appropriate for children learning language up to 9 years old who are minimally verbal. JASPER is a flexible and adaptable program that can be tailored to each child's unique needs and progress. JASPER is based on empirical research and incorporates numerous established theoretical foundations. It incorporates principles from developmental theories, such as Lev Vygotsky's emphasis on repeated social interactions with more sophisticated partners, highlighting the essential role of social interaction in children's speech and reasoning development. Additionally, JASPER borrows from the social interactionist theory of development, social pragmatic theory, and behavioral theory, along with the significance of language in structuring activities. All contribute, Additionally, JASPER borrows from the social interactionist theory of development, social pragmatic theory, the behavioral theory, along with the significance of language in structuring activities. They all contribute to the theoretical foundation of JASPER. JASPER is an amazing resource for professionals and caregivers. It helps children overcome social communication barriers and foster their language development. It's a brilliant example of how evidence-based, theory-driven interventions can make a huge difference in child development and communication.
Thank you for your time.